The incidence of breast cancer worldwide has risen by 20% since 2008. This cancer is the most common in women. While some experts are trying to find the cure for breast cancer, others are finding strong evidence that simple lifestyle changes such as healthy diet and healthy weight management can significantly reduce the risk for breast cancer. Are you at risk for breast cancer? Were you diagnosed with breast cancer? There is hope. So stand by as Get Healthy with Dr. Cooper starts now.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Hello everyone, I'm Dr. Cooper Dockery and welcome to Get Healthy, a program designed to educate, inspire, and empower you, the viewers, on how to live a happier, longer, and healthy life by embracing simple lifestyle changes. The month of October is designated as Breast Cancer Awareness Month, and therefore our topic today is prevention of breast cancer. Later in our show today, you will meet a very special lady who has had breast cancer. She will give you her story, and in the kitchen today, we'll have a surprise for you. So don't go away. Call your friends and relatives to watch Get Healthy with Dr. Cooper together.
If you are seeking to lose weight and reduce or eliminate medicine, we have the solution. Dr. Donna Cooper offers a book of secrets to obtain a healthy lifestyle. Get Healthy for Life. You can find this book online at bookstores or your nearest clinic. Go for yours now and enjoy the lifestyle you have been waiting for.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Cancer is the leading cause of death in the United States. It is estimated that in 2015, 1,658,320 people will be diagnosed with cancer, and that there will be an estimated 589,000 deaths. Breast cancer is the most common cancer in women, accounting for 33% of all newly diagnosed cancer. Statistics have shown that the death from breast cancer in the United States and United Kingdom has decreased by 25% since 2000. In order to continue to improve these statistics, one must first look at the various risk factors for breast cancer and learn how to modify them. These risk factors are: number 1, early menarche or early age for the initiation of the period. Number 2, late age at menopause. Number 3, late age at the first full-term pregnancy. And later, obesity increases the risk in premenopausal women. Having a first-degree relative with breast cancer confers an increased risk, especially if both a mother and a sister have had breast cancer at an early age. Mutation in the BRCA1 and BRCA2 genes are associated with an inherited susceptibility to breast cancer at an early age. Are you at risk for breast cancer? Or were you diagnosed with breast cancer? Is there anything you can do to prevent yourself from breast cancer? Studies have shown that making simple lifestyle changes may indeed protect you or may reduce your risk of recurrent cancer, especially women who have been diagnosed with breast cancer. Let's begin with simple routines. Number 1, you must obtain a yearly screening mammogram for those women age 40 and above. Number 2, monthly breast examination are also important. Most breast lumps are usually detected by the patient herself. Number 3, avoid prolonged use of hormone replacement therapy, that is the use of estrogen. Number 4, embrace a diet that is focused on optimizing your health and reducing disease risks will include fresh and whole food and be rich in a variety of vegetables. Research has shown that cruciferous vegetables such as broccoli, Brussels sprout, cauliflower, kale, and cabbage are closely associated with reducing the risk of cancer. Avoiding sugar, processed or refined food will lower the formation of bodily toxin and improve weight management. And number 5, regular physical exercise. Moderate to vigorous exercise for at least 30 minutes a day can significantly reduce the risk of obesity, hyperlipidemia, diabetes, hypertension, and even the risk of cancer. Number 6, maintaining an adequate level of vitamin D is shown to reduce the risk of breast cancer. Vitamin D is a pro-hormone that impacts gene modulation. Therefore, having an adequate level of vitamin D will decrease gene mutation and therefore decrease the risk of cancer. So, in addition to having the yearly mammogram, ask your doctor to check your vitamin D level at your next visit. Don't go away. We'll be right back with more information on prevention of breast cancer. Hi, I'm Dr. Cooper Dockery. Did you know that prevention of diseases is the gold standard to keeping you healthy? But early detection is also vital. So why don't you call your doctor today for an evaluation?
(150/90).
180/111.
160/110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
In our headlines today, researchers now believe that simple lifestyle changes may reduce the risk of breast cancer. In September, a study published in JAMA Internal Medicine found that in addition to preventing heart disease, a Mediterranean diet supplemented with extra virgin olive oil offers beneficial effect in the prevention of breast cancer. This paper is the result of a secondary analysis for a trial designed to observe factors affecting cardiovascular risk. The study evaluated more than 4,000 women ages 60 to 80 over a period of 6 years. Participants were randomized, assigned to a Mediterranean diet, supplemented with either extra virgin olive oil or supplemented with mixed nuts on a controlled diet. The women who ate Mediterranean diet with the olive oil lowered the risk of breast cancer by 68%, more than those who were given the low-fat diet in the control group. A preliminary case study also found a link between diet and breast cancer prevention. The early results suggest that a ketogenic diet, which is low carb, supplemented with vitamin D, reversed the expression of HER2, a gene that is associated with the risk of recurrence of breast cancer. This is Dr. Cooper Dockery. That has been our health news for today. We'll be right back with more information on prevention of breast cancer. So don't go away.
Your girls have been with you through every moment of your life. They were with you when you felt unbreakable, and with you when you had your heart broken. They were with you when you shared your love with the world, and with you when she became your world. They're still with you right now. But how well do you know them?
Welcome back. Today we have been talking about breast cancer and the prevention. And today in our studio we have a very special person, Jenny Trevino. Jenny, you have been diagnosed with breast cancer twice. Tell us about yourself. Tell us something about your story.
Well, first of all, I did my monthly breast examination, which I found my lump, and I immediately went to see my physician, where she ordered a mammogram, which it was done, and rapidly she called me back. My physician called me back and said that I had to keep an appointment. So I did keep my appointment, and she gave me the news that I had some lump in my breast and I needed to go through surgery. And I was just shocked, devastated with the news. I just couldn't believe this was happening to me. And the same week I get referred to my surgeon, who is a wonderful surgeon, and we had this done here locally. I had a right radical mastectomy. Everything went beautifully. I recuperated. Then I find myself having to go through chemo and radiation following my breast cancer. The side effects of the chemo were very, very severe in my body. I couldn't take it. They were so strong. I got so sick. So my doctor had to decrease the amount of medication I was receiving so that my body would be able to tolerate the chemotherapy.
Very good. You said you found the lump with your monthly breast examination.
Yes.
You know, most patients with breast cancer are the ones who usually find the lump. So what would you say about the monthly breast examination? Is that very important?
It is very important. It's the first step of prevention. It is also the first step of diagnosing it at an early stage.
Very good. Now tell me, the diagnosis of breast cancer, how did this affect your family?
My family was also very devastated, but due to very spiritual beliefs and very good family support, they were all taking turns caring for me at the hospital.
Very good. What about the effect of the chemo on your body? Would you say that was very difficult for you?
It was very scary, very difficultly. I was so weak, I just laid there for 3 days after my chemos, in bed, not wanting to eat, not wanting to continue. But due to the spiritual guidance that I have, I continue to deeper into my spiritual and pulled me through with my good family support.
Very good. So would you say your faith in God was very essential for your healing from breast cancer?
Yes, it was. It's the number one key, essentially. I pray to God. I ask God to guide me, to hold my hand every time I receive my chemo. And even though I was weak, I asked God with all my heart to please carry me when I couldn't carry my own body.
Very good.
And without this, I don't think my chemos would have been possible.
Right. You know, studies have shown that faith and meditation is essential for good health. And I think that's what you expressed,
Yes.
and that's why you're here today.
That's why I'm here today. After 7 years of remission, then I'm headed again with my second diagnosis of breast cancer.
And what happened this time?
This time I went out of town to get my diagnosis. It was completely different, completely different. A diagnosing, biopsy, everything went well, but it happened at MD Anderson
Very
the
good.
second time around.
So now you have bilateral mastectomy.
Yes, I have a bilateral mastectomy, and I still feel very strong as a human being.
Very good.
I'm not any less because I don't have my own breast.
Very good. So your self-esteem has not suffered.
No, my self-esteem has not suffered at all.
Very good. You're a nurse, Janie, and I know that you continue to work after your first mastectomy and your chemo, radiation, you continue to work on the second breast also. How are you doing right now?
Right now, I did return back to work. I wasn't able to pull as much or push patients, but my care never suffered, my patient care. I love my job. I love helping people. So I am blessed to even teach my patients that are suffering from cancer,
Very good.
What would prevention.
How would you advise the public about prevention and early detection of breast cancer?
The importance of monthly breast examination is essential. And second, we need to follow up with a mammogram yearly. And we find any abnormals, refer to your physician immediately.
Right, so there has to be a collaboration between the patient and the physician.
Yes,
Right.
there
And
has to be.
What about the risk factors? We're going to talk a little bit, maybe a minute, about risk factors. Did you have risk factors for breast cancer?
Yes, we do have risk factors for breast cancer. It is in my family.
I see. Who in the family has breast cancer?
Myself and one of my sisters have breast cancer.
So now it placed you at a higher risk.
It placed me at a very high risk for breast cancer and other cancers in my family.
Thank you so much, Jenny, for being on our show today. I know you have much more to tell us, so don't go away. We'll be right back.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Welcome back. We have been talking with Janie Trevino, who is a two-time cancer survivor. And Janie, tell me, what have you done to look so well despite two breast cancer and maybe another cancer?
Yes, I have been diagnosed with cancer 2 months ago, and I've undergone another surgery. So I'm a third-time cancer survivor.
Interesting. What are you doing now to prevent the fourth cancer?
Well, let me tell you, I visit my doctor since I first had my cancer, and I always tell my doctor, when are you going to order my new body? When are you going to order my new body? My doctor just laughs. But now, thanks to God, we have a brand new program here in the Valley. It is called Cooper Wellness Center. I have been referred there. I have learned a plant-based diet.
Right.
And I am starting on my diet. I'm eating well. I'm able to sleep. I'm happier. I can cook a very nice dinner for myself and my plant diet food, and a regular diet for my family, but they think they're getting a regular diet, but they're already 60% into it.
Very nice.
So soon I will be
Totally plant-based.
Totally plant-based on them.
Very good. But you're totally plant-based right now.
Yes, I am.
So no animal products.
No animal products whatsoever.
And how are you feeling?
I feel wonderful. I feel just a little bit more energized and so happy. Happy I haven't felt in years.
Very good. So therefore, studies have shown that patients who stay on a plant-based diet will decrease the risk of many different cancers. And I think you're one of those patients. So what would you advise the public to do?
I advise the public to go ahead and take control of their lives.
Amen.
Now that we have this plant-based diet, training here, Wellness Center, I invite each and every one of them who is tired of feeling tired, sick all the time, to make an effort, go by there and be my guest for one day, learn about this, what we have available here in the body, in the Valley, and ask the doctors also not to do a plain, easy fix on medications. For example, patients that are hypertensive, just add another hypertensive medication. Patients that are diabetic, that we are so well known here in the Valley, have increase of insulin, increase of hemoglobin A1Cs, increase of medications. Doctors, take the time. Don't do an easy fix anymore. Send these patients out to the Wellness Center. Make them aware that they can take control of their bodies, control of their diet.
Thank you so much, Janie. And I know that with your positive mind, your changing lifestyle, you are going to be living a longer and happier life. Thank you, Janie, for coming. And I hope you continue to do well and that this will be your last cancer. Thank you.
Thank you so much, doctor.
Don't go away. We'll be right back with more on prevention of breast cancer. Hi, I'm Dr. Cooper Dockery. Did you know that prevention of diseases is the gold standard to keeping you healthy? But early detection is also vital. So why don't you call your doctor today for an evaluation?
This is the story of a boy who was very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
In the kitchen today, we have Maribel.
Thank you, doctor, for inviting me.
Maribel, we have been speaking about breast cancer, early detection and prevention. And we know that healthy nutrition is one of the goals to prevent any cancer.
That is correct.
What do you have for us today in the kitchen?
We have something raw, like you all know. All our green vegetables are antioxidants, but they're very good at fighting cancers. Any type of cancer, not just breast cancer. So today we're cooking, or we're really not cooking, we're tossing a raw kale salad.
All right, go right ahead, Maribel.
Okay, we're gonna start by adding our kale. And you're gonna pick 2 bunches of kale, wash them 3 times at least, cut them, and the best recommendation that I have is not to put the veins. Not that we don't like them, but if the first time you try it, it might be a little bitter.
And sometimes the vein is hard as well.
That is correct, the texture of it. Then we're gonna go ahead and add 2 medium zucchinis, and the way you're gonna cut them is just along, or julienne.
Very good. All right. So you're using green vegetables. Green vegetables, as you say, are good for any cancer.
Any cancer.
Antioxidant, which means anti-cancer. Go ahead, Maribel.
We're going to proceed by adding celery. Another, even if it doesn't look that green, celery has been proven to be a wonderful anti-cancer fighting agent too. And it's also good for blood pressure, like we all know.
Very good.
We have a diced or chopped bell pepper. Gonna try to put them on the side so you can see all of that, and we will toss it at the end. Find yourself a small or half of an onion and also put it in there.
Very good.
We found some cherry tomatoes, at least 12, and go ahead and just cut them in halves.
And we have different colors, and remember, there are different vitamin minerals with each color vegetables.
Yes. What we're gonna do is add a little bit of protein, or our omegas, which are our nuts. And we have some pine nuts, and just drizzle them, and I'm gonna save some towards the end, and some chopped pecans. Save some for the end. And then we're gonna use the juice of 1 lemon and just squeeze it evenly around. And if you want to save the other half, like I saved my nuts, just to wait until after you toss it. Some of us need a little extra. And what would you recommend, Dr. Cooper? A little bit of...
Probably add a small amount of olive oil.
Correct.
But remember, you don't necessarily need the oil because you already have the nut. But if you need a little extra, then the olive oil is okay.
Olive oil. Or Mrs. Dash also. And it comes with either salt or salt-free. And you can add a little bit of Mrs. Dash depending if you need a little extra salt or seasoning on it. We will continue to add the last part of our nuts. Pine nuts.
And this is a very wholesome salad, as we say. You notice you have the nuts, which gives you your good fats. And of course, you have all the vegetables for the fiber, the minerals, and the phytonutrients. All right, Maribel, I think that's going to be very delicious.
It is, Doctor.
All right. So, Maribel, I recommend this to anyone who wants to live a happy, healthy, and longer life. And for more recipes, visit our website, www.gethealthywithdrcooper.tv. Thank you, Maribel.
Thank you, Doctor.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes. And way over here, busy moms. No?
The word cancer has a negative connotation. It brings stress, anxiety, fear, and even depression. No one wants to be told that he or she has any form of cancer. However, if you are suffering from any form of cancer, there is hope in the great physician, your Lord and Savior. In Jeremiah 29:11, it reads, "For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future." For more information on how to live a long and happy life, please visit our website, www.gethealthywithdrcooper.tv, and leave a message or visit us on Facebook. Until next week, same time, same station.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website www.cooperwellnesscenter.com.